Hello! If you're viewing this video, then you're preparing to take your baby home. Congratulations!
This is an exciting time for you and your baby, and you probably still have a lot of questions and concerns. That's normal. Many parents express feelings of anxiety at the thought of not having the immediate support of the NICU staff.
Rest assured that our NICU team is here to help you make the transition and answer any questions you may have. You're going to do great. To help you with your transition, we're here to discuss some of the most common topics related to caring for your baby at home. These include discharge requirements, creating a safe sleep environment, tummy time, car seats, jaundice, feeding your baby, milk mixing and medications, vaccinations, period of purple crying, preventing illness, and what to do in an emergency.
First, let's look at the criteria required for your baby to be discharged home. Your baby must be able to take all their feedings by mouth, either by breastfeeding, bottle feeding, or a combination of both. They need to have gained adequate weight. They should breathe on their own. They should be able to maintain their temperature, and they should safely fit and maintain stable breathing in a car seat.
It is essential to create a safe sleeping space for your baby to help prevent sudden infant death syndrome, otherwise known as SIDS. Here are some things you can do to create a safe sleep space at home. Place your baby on their back to sleep in a crib or bassinet. Keep the crib or bassinet clear of any extra items. Avoid the use of sleep positioners, bumpers, or pillows. The crib mattress should be firm, hard enough that it doesn't indent when your baby lies on it. The crib mattress should be flat. Do not position your baby at a slope. A well-fitted sheet should be placed over the crib or bassinet mattress. Your infant should sleep in a lightweight sleep clothing to prevent becoming too warm. A wearable blanket or sleep sack is a great option. Keep the air your baby breathes smoke-free. The American Academy of Pediatrics recommends sleeping in the same room, but not the same bed, until your baby is at least 6 months of age, and preferably until 12 months of age. Make sure every sleep is safe. Stay awake if you're holding your baby, or set them in a crib or bassinet if you feel sleepy.
Tummy time is very important for your baby's development, but should only occur when your baby is awake and can be directly viewed. Tummy time can be done by holding your baby on your chest while you are leaning back or lying down. Once they reach term age, you should transition your baby to a mat or blanket on the floor for tummy time to allow your baby to gain strength and head control. Please read our tummy time handout for more information.
If your baby is born preterm, at low birth weight, or has problems breathing after birth, we will perform a car seat challenge prior to going home. This means that your baby will be placed in their car seat and monitored for breathing problems for a period of 90 minutes. We'll also test for proper fit. Make sure that your car seat is the right size for your baby and that it can be installed securely in your vehicle. You will use the car seat every time your child rides in the car. Infants should ride in their car seat rear facing until at least 2 years of age. Car seats should not be used for sleeping or other purposes outside of car travel. Please watch the car seat video available on YouTube channel for more information.
Jaundice is the yellow coloring of skin produced by the buildup of bilirubin, which is created when old red blood cells are broken down by the body. All babies have some level of jaundice. However, if bilirubin builds up too high, it can cause problems. All babies will be monitored for jaundice, and in some cases, babies will need help to break down the bilirubin. At home, you can monitor your infant for jaundice by paying attention to their skin color changes, especially on the abdomen and legs. Yellowing of the eyes is another symptom of jaundice. If your baby is not feeding well or is sleepier than usual, this could also indicate jaundice and is a reason to alert your baby's doctor.
Your baby should eat every 3 hours, which is about 8 feedings in a 24-hour period. This will ensure your baby gets enough nutrition to gain weight and not get dehydrated. Always follow the feeding recommendation and mixing instructions included on your after-visit summary. Your baby's doctor will continue to closely monitor weight gain and growth to ensure that your baby is getting enough nutrition to grow.
Your baby will likely need continued support with bottle feedings until they're able to exclusively breastfeed. Most babies go home on a mix of breast and bottle feeding. We will provide an individualized recommendation for breast and bottle feeding volumes at discharge. It's important to continue pumping after each feeding. A lactation nurse can help to prepare you for discharge home and provide an individualized plan for you and your baby. We recommend lactation support at the Providence Mother-Baby Clinic as needed to progress with breastfeeding at one's home. The contact information to the clinic will be listed on your after-visit summary.
Breast milk that is freshly pumped can remain at room temperature for up to 4 hours, or can be placed in the refrigerator for up to 4 days before being used. Breast milk can also be frozen for up to 4 to 6 months in a regular freezer or up to a year in a deep freezer. Once breast milk is thawed in the refrigerator, it should be used within 24 hours. Thawed breast milk should not be refrozen. Once breast milk has been warmed, it should be used within 1 hour and then tossed. Many infants will need fortifiers added to breast milk or higher calorie formula to help with growth. Follow any specific milk mixing instructions included on your after-visit summary.
We encourage you to talk to your healthcare team about medications for home. We recommend getting medications before discharge, as sometimes liquid medicines can be hard to obtain. Your NICU care team will walk you through how to mix milk and drop any medications that your baby may be discharged home on if needed.
The American Academy of Pediatrics recommends all newborns be given their first shot of hepatitis B vaccine before leaving the hospital. If your baby is in the NICU for a longer stay, they may receive their first set of childhood vaccinations while in the hospital.
All newborns cry. It is their primary method of communicating and does not always signal pain. The period of purple crying is a time during your baby's normal development when they seem to resist attempts to soothe or be calmed down. It peaks when the baby is around 2 months of age and continues up to 5 months of age. This occurs most frequently in the evening and can at times be long-lasting, up to 5 hours a day.
Newborns are at an increased risk of illness. Babies who are born at a low birth weight or preterm are at an even higher risk of becoming ill. Recommendations for preventing illness after going home include frequent hand washing, especially after changing your baby's diaper. It's also a good idea to avoid crowded places and closed-in spaces and stay 6 feet away from anyone coughing or sneezing.
It is important for you to choose a follow-up doctor for your baby. We recommend that you schedule a follow-up appointment for your baby to be seen within 2 to 3 days following discharge from the hospital. Your baby's discharge information will be sent to your baby's doctor. Once your baby is discharged from the hospital, it is important for you to call their doctor for any medical needs.
If you think your baby is seriously ill and you are unable to contact their doctor, parents should take their child to the nearest emergency department. Some common reasons to seek medical care for your baby are a temperature of 100.4 degrees Fahrenheit, that's 38 degrees Celsius, or greater under the arm. Seriously ill infants may not always have a fever. New or increased difficulty breathing, increased sleepiness, or increase in irritability. Watch for dehydration. Look for dryness of the mouth, decrease in number of wet diapers, decreased tears. Babies should have at least 6 to 8 wet diapers a day. Jaundice is another potential concern. Contact your baby's doctor if your baby's skin looks yellow, particularly on their legs and abdomen, or if their eyes turn yellow, or if the jaundice is also accompanied by increased sleepiness, poor feeding, excessive fussiness, or signs of dehydration.
Other follow-up appointments that your baby may need, including developmental follow-up, eye doctor, etc., will be printed on your discharge after visit summary with dates and times of appointments.
We have talked a lot about how to care for your baby at home. We want you to remember that it's also important to take care of yourself. Whether your baby has been in the NICU for a few days or a few months, the experience can be stressful and traumatic for families. It's not uncommon for new parents, especially NICU parents, to to feel overwhelmed and anxious. Studies show that postpartum mood disorders can occur up to a year after delivery.
It is okay to get help for yourself. Help can look like talking to your partner, family, friends, or a community leader. It can also look like talking to your doctor, joining a support group, seeking a counselor, or other professional in your life. There are a lot of options, and no one wants you to feel your best more than your baby.
There are also some simple things you can do to promote self-care. Have a daily routine that includes eating healthy foods, getting active, even if for short bursts of time, drinking enough water, and sleeping as much as you are able can all help your body feel better and work better. Ask trusted friends or family to help with errands or household tasks. That's another way to reduce stress in your life. Just remember to take care of yourself.
On behalf of the care team at Providence, thank you for the privilege of being able to care for you and your baby.
Best wishes to you and your family as you embark on the next step of your journey.